and welcome to our final webinar of the year 2024 Workplace Trends and Predictions that you need to know. We always enjoy hosting these events in December because it kind of gives you a heads up of what to expect from this for this next year so that you have an idea of what's ahead, what you're going to see. And whenever I pull the information from this prior year that we did, that information was kind of accurate, Dr. Les. I remember you had said that. I wonder how accurate that we actually are. But I pulled it and we were pretty accurate. So who knows? Maybe we have the crystal ball after all. You never know. Before we get started, in case we haven't met, my name is Holly Foxworth. I'm a registered nurse. I am also the marketing manager of content here at Axiom Medical, and we have brought together the entire team to join us today. We've got the triple Ds, both docs and Dara, and so we are going to hash out all things 2024. Before we get started, I would just like to bring your attention to several things that are there on your screen so you can get acquainted. So the first thing that I want to draw your attention to is on the right-hand side of your screen. And so that one should be a box. It should be see like a red light that looks like it's blaring. That is for our next event. So that'll be the first event of 2024. And so that one is red flags, early warning signs of workplace violence. We'll have a panel that will come in, talk to us about the alarming rise in workplace violence, why it is we think that it's never going to happen to us, what some of those early indicators are, how it is that we can act, and then also dive into some of the legislation behind that that's specific to employers that's going to take place later on this year. So that goes into planning to investigating, reporting, etc. So definitely press that button, make sure that your seat is reserved. Next thing I wanted to talk about was expression. So the other place, my other favorite place for all of you is at the very bottom of your screen. You hear us talk a lot about the Q&A box or the Q&A chat that's there. And that is the first place that I go whenever I go to send love notes after these events for questions, great questions that were asked. So if you have any questions, comments, you want to put in tell us where you're from, whatever it is, please feel free to do so. You can utilize that box, and we love to hear from you. But if you do not want to write in a question, we do have another option for you, and that is the emojis. So you should see maybe a thumbs up at the bottom of your screen. So those emojis, I think there's a heart, there's a thumbs up, etc. But you can utilize those. That not only tells us what's important to you, but it also tells us what would be helpful to other people. So please utilize that. Interact with us. Again, if you have a question, ask it. This is the time to let it all hang out. There's no reason to be shy around here. So we'll start with introductions. Dr. Cherry, I'll start with you first, followed by Dr. Les, and then we will go with Dara.
Well, thank you, Holly. Good afternoon, everyone. Thanks for joining. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. I'm board certified in preventive medicine, public health, and occupational environmental medicine. I've been supporting the U.S. military, government, and industrial operations for the past 15 years, and it's a pleasure to be with you today.
It's a pleasure to have you here as well. Dr. Kertay?
So I'm Les Kertay. I'm Senior VP for Behavioral Health at Axiom Medical. I'm a clinical psychologist and boarded in psychology. And for the last 25 years or so, I've been mostly involved in workplace mental health. That's really my passion, and that's what I came to Axiom to focus on. And I'm happy to be here and welcome everyone.
Awesome. Last but not least, Ms. Wheeler.
Hopefully everybody can hear me okay. Thumbs up, Holly.
Yeah. We can hear you.
Hi, everybody. My name is Dara Wheeler. I'm Axiom's Chief Marketing Officer, and I'm really excited about this topic. It's been something that Holly and I have been talking a lot about, and we're excited to share some of the information we've gathered for you.
Awesome. Thank you. Well, I appreciate all three of you joining today. We do have one poll question as we start, and before we talk about what we'll get into today. And so that first one is, how prepared are you, is your organization, for the new OSHA electronic submission requirements? So would that be fully prepared, somewhat prepared, not prepared, or not applicable? So tell us where you stand on that spectrum. So in terms of discussion topics and what we're going to get into, so we're going to get into some of the labor market expectations. We're going to talk about some of the federal and state specific legislation. That's where things get a little bit spicy, though. It's always a fun one. I think Dara's going to cover some of those. You'll definitely be interested in those. We're going to talk about the injury predictions, and we're going to talk about workplace readiness. We'll wrap up with connecting the dots between mental and physical health. And then finally, we will talk about what it is that you specifically need to get right in 2024. Dara, I'll come to you first. And the first quote of the day was, the job market is continuing to grow steadily. The economy is beginning to resemble its pre-pandemic self, and confidence is growing that a recession has been avoided for now. And companies are once again investing in growth. That came from Forbes. Do you agree with that?
Yeah, I think it's been interesting. It's been an interesting year where we've been waiting for these recessionary cues to really kick in, and we've seen some pieces of it, like inflation at the grocery store and some other areas. But right now, what we're seeing for 2024 is that hiring is looking pretty good in terms of unemployment. We're still looking at strong employment. We're looking at lots of job openings for everybody unemployed. Productivity and thinking about AI and automation, we are hearing a lot of, although there was a lot of initial anxiety and fear around job replacement with AI and automation, I think we're actually seeing some of the opposite. We're seeing a lot of jobs created. There's now new roles like prompt writers and people having to learn how to do different things within that space of AI and automation. But this final point, I think, is crucial. Looking at reskilling and upskilling people and workers for what's coming is going to be really critical in the coming years. And I know a lot of HR departments and teams are thinking about how to do that and provide good resources for employees around upskilling. It's something I'm definitely thinking a lot about. We always joke that 20 years ago, nobody would have done or had a role that was a podcaster. We don't even know yet what some of these roles are going to come and look like in the coming years. But so far, next year is looking pretty strong from a economy standpoint. So we'll just have to keep a close eye on that.
Awesome. Well, Dr. Cherry, I'll come to you next, and we'll kind of, before you get into some of the OSHA information, we'll look at the results that we had. So it looks like that the majority are somewhat prepared, and some are non-applicable. Others are fully prepared. Others maybe just not prepared as much yet. Anything surprising there? There's a lot of big changes on the horizon.
Yeah, for me, it's always interesting to see what our audience experience is, but yeah, it looks like there's a nice distribution of those in different readiness states,
Mm-hmm. Mm-hmm. Well, talk us through some of the specific changes that come along with what this final rule is for the injury and injury reporting requirements.
Yeah, certainly. So in January, it looks like this will become effective where businesses with 100 or more employees in certain high hazard industries are required to electronically submit their OSHA Form 300 and 301 annually. And it looks like it's going to be more detailed than, previous requirements with regard to, date, location, severity of injury, more specific details about the injured worker demographics, and then kind of how did the injury or illness occur. And looks like the first new deadline will be March 2nd of next year, where really they're starting to have teeth where this needs to become effective. But additionally, there's still requirements or continued requirements for other sized employers, namely, between 20 and 249, you still need to submit electronically. And then the larger businesses as well with 250 or more still need to submit their information as well to OSHA. One interesting tidbit is the legal company name requirement. I guess some folks are using the doing business as companies, but now they're looking for really the actual legal company requirement, which I guess gives more transparency. And, I think what's happening is there's going to be more public posting of this data from OSHA to where people can see this more broadly. And so really there's an interesting impact and intent to where, OSHA is hoping to really focus on these high hazard industries. They say it's really, these new requirements are really a small percentage of establishments, but less than 1%, but actually cover about 30% of all occupational injuries and illnesses. And so, again, this is focusing on high hazard industries. And I think as we've thought through this for our clients, the concerns to employers is that public availability of injury and illness information could lead to more scrutiny by unions, plaintiff lawyers, and OSHA itself, potentially leading to more inspections and enforcement actions. So really preparation is key. So, it's great to see that a fair amount of the audience here is either fully prepared or somewhat prepared, but really wanting to, encourage those to become fully prepared, because this does look like it can be higher visibility. And so really something important to, focus on. And so they have listed some or some industries like bakeries, beverage manufacturing, plastics manufacturing, motor vehicle manufacturing, grocery stores, department stores, warehouse and storage, hospitals, but formally it's through the NAICS codes. So you can look up those specifically to see if you are, specifically required to comply with this.
Yeah. Dr. Cherry, Melanie had a question, was asking, is OSHA's changing who is required for mandatory reporting, and will restaurants be moved to high risk? That's a great question.
Yes. I believe they were listed just based on category, but you do want to pull up that specific coding. There may be some nuance between different types of restaurants or food makers. So just to make sure you're, falling under that line.
Absolutely. And then she was also asking about the legal name for employers and headquarters. So is your understanding then that this is to be the official legal name that you're putting there on your reports?
Correct. So a lot of companies will have entities that are DBA, doing business as. So I think in many ways, even in contracts, the DBA name is okay, but here it looks like they're looking for the legal name. So what's probably formally listed as the LLC or other, legal entities. So I think maybe getting legal advice to make sure you don't fall afoul to it, or you're in line with what the requirement is, but also with what your business is looking to do from its formal structure. So absolutely. I've just seen that in the past in my different roles. The DBA is very interesting sometimes, the doing business as,
How do you think that this is going to impact us from a larger perspective in terms of the transparency that's here? Do you think that there'll be some concerns there about the logs that have to be turned in, and when employers have to show what type of injuries that they're having?
Yeah, I wonder if prior to this rule change, if you had to do a FOIA, right, like a Freedom of Information Act to get it from OSHA, from certain companies, but now it may be as you can query it through the internet, right? Like some of the Department Labor of Statistics, but it really can be fodder for potentially even podcast or independent internet folks that are looking to focus on certain aspects of workplace safety and health. I think for me, and something lesson Dara and I have been thinking about the last few years is like mental illness, because it's becoming so popular in the news and things like that. If that becomes a covered illness,
Right.
would that eventually become something that's reported? Because it's potentially under workers' comp, right? But it's a separate set of approval requirements. But I think this is going to make, I think this is going to shake up things in a lot of ways. And I think the internet has really changed how the culture of at least America, but I'm sure other countries as well.
Yeah, absolutely. Dara, Dr. Kertay, anything that you wanted to add there? No. Okay. Well, Dara, we are up next with you with the state-specific legislation changes, and this is where the good stuff always comes up. And so, talk to us about these.
Yeah, and Holly and I are going to put together a whole bunch of webinars and topics around this too, because it's something that comes up a lot, especially around cannabis use and testing in the workplace and different things that are always of interest to employers. But in California, we've seen as of January 1st, 2024, there's going to be some new regulations coming into effect, including the prohibition of discrimination against employees for cannabis use outside of work hours. So there's some pretty major implications for employers in the state of California when you're looking at workplace policies and you think about zero tolerance and what that looks like for your workplace. We're not going to provide legal advice on this webinar, but reach out to your legal teams to make sure you've incorporated what you need to in terms of your policy. Now, of course, a workplace can still maintain zero tolerance or drug-free workplace policies, but you might just want to review specifically around safety-sensitive roles and what that looks like in terms of your actual testing policy, because current testing procedures for marijuana and cannabis unfortunately don't necessarily show impairment at the time of the test. It shows potentially impairment from a previous time frame. So definitely review those policies and make sure that you've got those ready to go for the new year in California. In Colorado, you've had some similar situations coming up in 2024. That's one of the new regulations is around decriminalization of psychedelics and psychedelic medications. So making sure that your policies and your drug testing practices have taken that into account is going to be really important. If you are a federal employer, then we want to make sure that you've got a federal policy or federal considerations, because it's still a difference between state policy or regulations versus federal. But if you have employees in that state, you just want to make sure that you're updating all of your policies and balancing the rights of the employee with the safety of your workplace and how you manage safety and making sure that employees are taken care of. And then finally, you're seeing some changes in Connecticut work comp, also going into effect January 1st. So when we look at work comp in Connecticut, there is going to be included coverage for post-traumatic stress injuries for all employees. And so that's an expansion from previous policies, which often limited PTSD coverage for certain professions. But this is for all employers within the state of Connecticut, or all employees within the state of Connecticut. So when you think about work comp policy for employers there, although it's not a huge state, anybody who is managing teams within the state of Connecticut needs to review those work comp policies and practices. And we're seeing a lot of different employee rights and policies coming up within various states. And so make sure that you're staying up to date on that. There's a lot of changes around drug and alcohol policies, around non-compete and employer and employee relationship policies, employee rights, wage transparency. You're seeing a lot around wage transparency and making sure that you're publishing when you're posting jobs, what the wages and the wage ranges are. So make sure that you're consulting with your counsel and making sure that all those policies and procedures are ready to go for 2024.
Excellent. That'll be interesting, especially about the Connecticut piece. I think that the expansion of the PTSD for employees, I think that could be significant, and it's a step in the right direction. I like to see, at least from a mental health perspective. I would assume that you agree, Dr. Kertay.
You want an actual answer to that? To be honest with you, it worries me. I think it's a good step in terms of recognizing mental health challenges in the workplace. Mm-hmm. One of the problems with presumption laws is that it's actually most of us who experience a difficult event, even one that we would call traumatic, mm-hmm. do not suffer PTSD. Most of us incorporate that and grow from it. So when we have a law that presumes that if you're exposed to a trauma, you're presumed to get PTSD, that potentially creates a real challenge for treatment, for the compensation systems. I mean, it's so I have hesitations about it, despite the fact that I agree with you that it's a good step to acknowledge mental health. The problem is that the way that we're going about some of these presumptions actually could create some real problems.
That's a good point.
Hey, Dr. Kertay, I was curious because I've heard the term post-traumatic growth, right? Kind of just what you're describing versus post-traumatic distress. And my inkling was that when there is a stressful event, even an extreme stressful event, even in combat situations, that actually the ratio of growth to distress is in favor of growth. So like you're saying, if that is the case, that presumption law can actually be including a majority of false positives, so to speak,
Yeah, I think that's exactly the problem. And I mean, again, what's good about it is that it allows people who do have PTSD to get appropriate treatment, right? And that's really, really important because it's a very treatable condition. So that part is a really good thing. But to your point, it's not the most common thing. So we need not to trip over ourselves when we're trying to. We're already short of mental health, of good quality mental health provision, right? We don't want to burden the system with someone who doesn't need it. And so it gets to be a really complicated conversation to have. And I think it's important, and I think it's important for employers to understand it.
Yeah, definitely. Well, Dr. Cherry, you're up next, but before we do that, let's do another poll on another hot topic that we have here, employee fatigue. So tell us, how does your organization currently address employee fatigue? Do you have regular assessments? Do you do training and awareness, or do you have no specific measures? And if you have no specific measures, it's okay. You don't have to be ashamed to select that one. We completely understand there. We're all in a state of growth. But while you're working on that, then you're right, Dr. Kertay. While you're working on that, Dr. Cherry, talk to us about the injury trends. We talked a lot about this one last webinar whenever we dug into these specifically. But do you see that there's going to be, do you anticipate that we'll see any changes here in what we saw from 2023 to what we'll see in 2024?
Well, I think it feels like, at least since I've been, working in, industrial medicine and occupational medicine, probably almost 20 years now, it feels like sprains and strains are always like the most common and, the highest prevalence of nature of injuries. So I feel like that's going to continue just based on really robust personal experience. But I think, studies on this have shown this very clearly. And then obviously multiple injuries will kind of cascade from that, because you tend to have multiple musculoskeletal issues when that occurs. I think the last three are also strong candidates for continued top five as well. But depending on maybe the weather, that may change heat injuries from one spot to another. For our clients on the call, it really depends on the type of work they're doing as well. So if you've never really dealt with a heat injury, then you can obviously focus on the others. But, I think it just depends on industry specific for those bottom three. But I do feel like, again, the top two will remain with high probability. So yeah, those are kind of my thoughts for next year.
Okay. Well, let's look at some of our results here. So in terms of addressing fatigue, it looks like that there's some that are working on some training and awareness, and others that aren't really looking at that just yet. Mm-hmm. Why is this important, Dr. Cherry and Dara? What is the impact of fatigue on our workplace?
I can go first, Dara. So I think in many ways, just from a common sense approach, fatigue is really probably highly correlated with workplace injuries. But there are actually many studies that also speak to this as well. And so a few months ago, we had a client summit where we had this as a topic, and it really generated a lot of interest. And, after that, we actually collaborated with some of our clients to where they really wanted to incorporate this as an assessment to really prove within their own data set if this is a concern for them. Because if you have your own data, you can go to the specific decision makers in your company to maybe address it more importantly, right? And so I think this is absolutely going to change the paradigm of how we look at fatigue as a readiness indicator. And so, inherent to how we manage injuries, this will be part of the assessment when an injury comes through. And so, I won't necessarily read every question, but really it's looking at kind of the chronicity of fatigue or sleepiness and the intensity. How long have you been up? How many days of overtime have you had? When I used to be involved in root cause analysis of severe injuries, a lot of times these questions, when we looked at them, were really shocking about how long have you been up without sleep? How many consecutive days of overtime, things like that. So I think this is kind of like the biological plausibility is like a no-brainer, but to actually have data and going back to each client and saying, 20% of your injuries are associated with a certain level of fatigue, or 60% of your injuries are associated, or 90%, right? Like that will really be a nice leading indicator, so to speak, right, for how people can or how organizations can address fatigue strategically.
Yeah, definitely.
Yeah, super well said, Dr. Cherry. And I think that the clients that we've been talking to and hearing from are taking this work readiness concept even further with some of their approaches. So one of the areas of focus for Axiom this year has been mental behavioral health, and fatigue definitely is a component or has a place there as well. And so from a work readiness standpoint, often our clients that are heavy and very much focused on safety have been focused on physical safety. Mm-hmm. And we're seeing, again, kind of this holistic whole person approach where it's not just physical safety, it's mental and psychological and fatigue and all of these different things that play into whether somebody's safe at work and how safe they are for themselves and for others. So as simple as asking somebody, some of these fatigue questions, but also prior to shift, when people have safety minutes or safety huddles, it's asking some basic questions around, are you physically able to show up for work today? Are you mentally able and ready to work And have you, slept well? What are some of these things that we can do? And it's not that somebody would be penalized for not being ready, but it's being prepared for a workplace that is paying a lot of attention to workplace safety to prevent injuries and fatalities to that employee and to others. And so that environment, it really begets more of the psychological safety that we talk a lot about, because people feel more supported and more ready to talk about these things when they feel like their employer is listening and cares if they are ready or aren't ready to work for the day.
Mm-hmm. How are for clients that work closely with us, how are we incorporating this information?
So the one Dr. Cherry talked about here, this is all post-injury data collection. So an injury occurs and then we're grabbing that information post-injury. And we're doing a lot of really interesting things with that injury data, because we can start looking at, like you said, upstream from this and getting predictive or potentially preventative in the way we handle some of these components. But we do have some clients starting to use technology for workplace readiness screening and asking some of these questions of their employees and trying to decide from a policy standpoint, from a practical and procedural standpoint, how to manage an employee who's not ready to work for a day for some reason, for some component of these aspects, either physically, mentally, or through other physiological components. So it's a really interesting approach, because it's now asking employees to really take stock of their ability to show up and work each day. And it's interesting, you think of this in the physical health space, or these physically demanding jobs. We have a lot of clients that work in very heavy, physically demanding from a category perspective, but it's very similar. Even a company like Axiom, where we're all usually at a desk and not necessarily physically demanding, but definitely it takes a lot of mental demand on people. We have professionals, we have nurses. It's really important for other companies besides those in the heavy physical demands areas to pay attention to this, because mistakes can still be costly, and we want to support our employees if they're not feeling able to show up for work that day through policy. And so one of the policies we put into place this year at Axiom, which I think is just, I love it, and I've heard a lot of employers doing it, is having mental health days that it's no questions asked. If somebody's dealing with something, it doesn't even have to be themselves. It can be dealing with a kid or a loved one. It's like, yep, take the day. We'll see you. No questions asked. And that, for us, it gives us the ability as leadership and management to be able to say, hey, if you're not ready to work today, no judgment, take the day, and we'll see you tomorrow or whenever you're ready. And then when you are working, you're able to really be as productive as you can be.
Absolutely, yeah. Dr. Les, I'm going to come to you next. This is our last poll question, but we're going to get into all of the mental health component and stuff here. And Les has some awesome information that I think is going to surprise you guys when we look at the stats on what we were pulling here. But so our final poll question is, tell us, how well does your organization integrate mental health into its workplace safety programs? So would you say that is done very well? Would you say it's adequately? Would you say it needs improvement, or not at all? All right, Dr. Les, and I will turn it over to you.
Well, I think the place to start here is why do we care, right?
Yeah.
I mean, we care about mental health because we care about health, period. Right? Mm-hmm. And I like to think of myself as an early adopter of the phrase mental health is health. It's all one thing. It all goes together, and it's important. And it costs employers a lot to ignore mental health conditions. I'm gonna say this in a little more detail in the next slide, but psychological distress, so people being upset, substantially increases the risk of injury. Right? So 34% increase in the risk for injury. And I want everybody to hold that thought, that it's distress that is the issue. People lose a substantial amount, almost a third of productivity goes to mental health issues, stress, depression, anxiety. These are all, and they're not inexpensive things to manage. The healthcare costs are $10,000 higher for people with mental health conditions overall. By the way, the opposite of this we also know is true. There are multiple studies that indicate that when good mental health support and resources are available to people and organizations, total health costs go down. So despite spending money on mental health, the extra money on mental health, quote unquote extra, total healthcare costs go down. It's expensive to replace people. And that's one of the reasons that we lose people, is when they feel like they're in a workplace that isn't supporting their mental health or isn't taking care of their stress management. So that's just a few, highlights from this. We've spent the year really talking a lot again about mental health. It's kind of not as strongly in the conversation, I think, in 2023 as it was in 2022, but it's still there. I'm not yet convinced that we've gotten really good at integrating mental health into our safety and health and general health policies. So that's my take. Now I'll be interested to see what everybody else thinks, right?
Yeah, let's see what they said. Okay. All right. I think it sounds like that you're right. Yeah.
Yep. Looks like
improvement. So it looks like that we're all an area where we can all use some improvement there.
Yeah.
Well, talk to us about some of the data that we've collected and what that means, and getting back to the distress component that we talked about earlier.
So we started to incorporate an assessment of emotional distress into our injury case management and making resources available with behavioral health nurse case managers. I'm really pleased that I'm pleased that we are doing that. I'm surprised still that we're the only people who are doing that because of these numbers. But we've done over 17,000 assessments with this tool, and about 10% of those convert into cases, and that just means we reach out to that person and make sure they're doing okay. And sometimes they are, and sometimes they're not. And we've intervened in cases where people have been threatening suicide, where they've really been struggling, and we wouldn't have known had we not done that reach out. And I think that's really important. I said that I was going to come back to that notion of distress. The thing about this measure is that we are assessing how upset people are, that's actually the risk factor. It's not the diagnosis, right? A person who has a major depressive disorder that is well treated and stable is not at greater risk of an illness or injury than a person who is than the average person, right? It's not depression that increases the risk, and we want to be careful about that, because we don't want to communicate that we don't want to strengthen the stigma against seeking mental health care. It's the diagnosis is not the risk factor. An untreated condition or being upset, whether you have a diagnosis or not, those are risk factors for safety incidents. And that's why we started to incorporate this measure. And that's why we use measures of distress as opposed to screenings for depressive disorders or anxiety disorders. So I think that's a really, really important thing that I keep kind of, I think people may be getting sick of me like preaching about this, but I think it's a really important insight, and we have to make that distinction about, so that we don't discourage people from telling us about being, having a hard time, right? We want to make that a normal part of the discourse.
Dr. Kertay, Ben had asked a great question, which was, what is a K6 that we're referring to?
Well, it's a measure that is, it's well validated for a measure of symptoms related to, and they are related to depressive disorders, anxiety disorders, a number of other kind of psychiatric disorders, but the focus is on the current distress. How upset is a person in the moment, and that's what makes it a really powerful tool. So it's a set of 6 simple questions that do a quick assessment of, how upset is this person currently. The original was built in Harvard. It's really kind of an interesting, because it was built at Harvard, so it's a U.S. tool, but it's much more widely used everywhere else in the world than in the U.S. We don't tend to use this particular assessment tool, and I think it's unfortunate. But it was, the original design was to say how you've been feeling in the last 30 days. It turns out that you get almost no difference between asking about 30 days and 7 days in terms of the stability of the measure, but you get a better snapshot of what's immediate by asking the 7-day question. So that's one of the changes that we made to it, and that's been pretty well researched. So that's what it is. Sorry. Sorry for throwing that at people.
No, that's awesome information. So whenever you say types of stress, what types of things are you talking about that, people that would be suffering from maybe an anxiety attack, or are we talking about suicide? What specifically with some of those things?
It could be any of those things, right? It's like I'm more irritable today than I usually am. Any of those things form this notion of distress that may or may not be diagnosable. If you've seen me speak in public, one of the things that I always do is raise your hand if you've not been stressed in the last 2 years. And astonishingly, no one raises their hand. Or raise your hand if you've never felt anxious, right? We've all had those experiences, and the thing is that they may not need treatment. The answer to that isn't, send them to therapy. The answer is to find out more about what's going on and to make sure that they're being supported adequately. So I'm really talking about any of those things. I just woke up this morning and I am tired, and I can't imagine how I'm going to drag myself out of bed. That's a form of psychological distress, and it's common, right? It's not a mental illness. It's a common experience, but it can be a precursor to something that might need treatment, and it can also contribute to a safety risk.
Yeah.
Does that help?
It does help. Yeah, it does help. And some of the stories that we've had from this last year, and we started this in mid-January. Is that when we started doing some of these K6 assessments? Is that correct, Dr. Kertay?
I'm sorry, I don't remember when exactly we built it into all of the injury case management. But yeah, it was pretty early in the year. Actually, you know what? I can go look at a chart that somebody sent me just earlier. Yeah, February is the first month that we have data for.
Gotcha. But what got some of our attention was the things that had we not asked, that they wouldn't have been caught. Some of the you call in for a shoulder injury, and yet someone is struggling with suicidal thoughts, or someone that calls in for an ankle injury and it turns out that they have a substance abuse problem, and that's really what's going on in their life right then.
Mm-hmm. And it's important to know, we would sometimes, employers would be concerned that we're finding out this and that somehow it's going to become part of an injury report or, a workers' compensation case. But the fact of the matter is that the most important thing is that you do want to know.
Mm-hmm.
And it might not have anything to do with that shoulder injury.
Right.
But if you have an employee who's considering killing themselves, or who's got a serious alcohol problem, or they're so stressed about taking care of kids and parents that they're really not thinking straight, you want to know that, because you want to support them so that they can be a good employee. Well, that's my position, is that you're way better. This is one of those things like, ignorance is not bliss. Not knowing is not helpful. And I'm just going to say that flat out. I can't imagine why we wouldn't want to know and help take care of people.
Absolutely. Well, as we wrap up then here for the final of what you must get right in 2024, I'll ask from all of you kind of what your thoughts are on some of these. Where do we need to put the focus for this next year? Dr. Cherry, I'll start with you.
I think what hit me is don't wait for a crisis. And so when we reflect in our time in COVID, I think the organizations that pivoted most effectively was those that had proactive processes in place, maybe not necessarily for COVID, but because their safety culture was very strong and they had a hierarchy of control and the ability to, effectively make management changes quickly. I think when we look at the trends for next year, some of it is kind of required for the OSHA reporting, or even if you don't fall under the OSHA reporting now, maybe you should act as if you do. And so start thinking about proactive ways for injury management. And so, we've been looking at like fatigue and mental health as surrogates to readiness. And then we're going to look at it as well with the correlated fatigue and injury data post incident. But I think being very proactive when maybe, like what Les said, is not knowing is not a great answer for mental health, but really for any kind of major risks to your organization or to operations, right? So I think really starting to have strategies with regard to workforce readiness is key. And maybe you just focus on one thing, right? Like doing one thing is so much better than just thinking about 4 or 5 things that never get done. So, that's kind of my thoughts.
Good points. Dr. Kertay, I'll come to you next.
Well, to follow up on that, I think from a mental health perspective, I think I've been saying this for a while. I'm not sure if I said this about 2023, but I think it's really time to get right, that we need to have a thoughtful approach to how we're going to deal with mental health in the workforce. Like we're sort of, I think we're at the point where we're kind of getting past the, well, just send them to EAP, or, or give them a few extra days off, or throw an app at it. Right. I think we're at the point where maybe we can begin to have this conversation and say, we really need to think this through. Like, how are we going to create an environment for the workforce that is better supportive and taking care of people's mental health needs? I think the workers are demanding it. I think, the workforce is only getting younger, and the younger workers are really demanding it.
True.
So I think if I were going to say what's important to get it right, what's important to get it right is don't look for the quick solution around mental health. Look for something that's programmatic and get help building a good program. That would be my vote.
Absolutely. Dara, how about you?
Yeah, I say ditto, but I also think that what I'm seeing for this coming year is better ability for organizations to use data to target, and I'm not using targeted in a pejorative, I'm using target as in let's create programs for people that actually do something for them. And we can target people's health, and when I say health, I mean total health in ways that we haven't necessarily been able to do in the past. And Dr. Cherry and I were part of a conversation, and somebody mentioned the word wellness, and I think everybody in the room kind of shuddered. It was a bit of a visceral reaction to the word wellness because traditionally wellness has had a hard time proving out ROI and what does it really mean and why are we spending money and is it really just helping the people that are already healthy and what are we actually trying to do? And I think where we are is that we're in a place coming up in the next year where we can use real information to help employees really make big changes. And I think that's something that's exciting and different. Instead of creating programs that are one size fits all programs and throwing gym memberships at everybody, let's create real programs that actually help individuals. And then by helping individuals, that total population.
So no more pizza parties. Is that, you think maybe we could cross the pizza parties off the list as well?
Nurses love pizza parties.
Nurses do love pizza parties. Yeah. Let's see. We had another question that came in. What kind of signs can employers look for to differentiate mental distress and fatigue? Great question.
Les?
It is a really great question. I would assume if someone is expressing mental distress, I would just make the assumption that they're also fatigued. Because I frankly, and I wouldn't make it necessarily the other way, because there are lots of reasons to lose sleep. Losing sleep can add to or exacerbate an underlying mental health condition, but those, it's not necessarily paired that way. But I would just make the assumption that if you're measuring, if somebody's showing up as distressed, they probably are also fatigued. Because what do we do, right? When I'm worried about something, when do I worry about it? I worry about it when I'm supposed to be sleeping.
You're right.
Right. So I think that's I think that the fatigue is the most common physical reaction to feeling overwhelmed and wanting to withdraw. And so the distinction there is, okay, I'm tired. Why am I tired?
Yeah.
That's the question. Am I tired because I've been driving my kids to like 47 soccer games while trying to work full time, while, volunteering at their school? Well, okay, I'm tired too, just thinking about that. And there's a different answer to that than I'm tired because I'm completely overwhelmed. I can't get myself motivated. I'm really struggling emotionally.
Right.
You need to know why. That's the way to make the distinction.
Good points. There were some additional questions that came in. Let's see. Where is it? I had to ask. What are your thoughts on exposure to cold, like cold showers, for treating anxiety and depression?
Everyone wants to talk about mental health today. That's good. I like it. I like it.
I like it too.
Cold showers. To be honest, I don't know. I don't know if there's research behind it. I know that I would find it enormously stressful and anxiety provoking to be put in a cold shower. And I never do it voluntarily. So I wouldn't do it personally, but there may be some research out there that it's helpful. I'm not aware of it.
There is. There's
Okay.
definitely some research out there.
I was going to say, are you not a fan of the cold plunge?
That's different than a cold shower. But anyway, go ahead, Dara.
Yeah, no, you should definitely. There is a difference between a shower and a plunge. There's a lot of really good research out there. If you're interested, Dr. Cherry or I can forward you some of the articles.
Cool.
There's some really interesting stuff on both sauna and cold therapy. So heat therapy and cold therapy on managing anxiety and other symptoms.
Mm-hmm. Awesome.
There you go.
All right. One additional question. Do you have any recommendations on where to find sample wellness programs? Adam had asked.
You're gonna make me. You're gonna make me start cringing. It depends on what's my wellness, Adam. I can definitely point you in some directions. We'll follow up with some recommendations.
Yeah. Did you have anything you wanted to add to that, Dr. Kertay?
No, go ahead.
Okay. All right. Parting thoughts as we close out the year here. Dara, last parting words.
I hope everybody isn't fatigued just listening to us talk about this. I feel like I am, and I feel like this time of year is always a little bit interesting with work and family obligations. So I hope everybody takes a moment and is able to spend some time on recovery. If it's in a cold plunge or a sauna, take a moment for yourself and try to not just survive this busy season, but thrive in it. So that's going to be my statement for today.
I like it. Dr. Cherry, how about yours?
So we're obviously talking about the future right now, but I think it's good to plan for the future. But personally, everyone should be in the now as much as possible too. So that will dramatically help with anxiety or guilt of the past, so to speak, right? So it's a nice way to shift from your professional side to your personal side. So happy New Year, everyone.
Yeah. And Vanessa, you are correct that there will be a recording of this webinar. It's usually available within 24 hours afterwards, and you should be able to get a link to go back to that. And then we will wrap it up. We will finish it up with Dr. Kertay and your final thoughts.
Final thoughts for the year. I'm going to follow up on what Scott just said about being present. Sometimes, and I'm aware that I do this, sometimes when I talk about mental health, it's like such a big topic to me, and it's really important to be programmatic that, one of the simplest things that we can do for ourselves is just take 3 deep breaths and pay attention, right? It's a fast way to show up. Doesn't require a cold shower. And it's astonishing how much benefit you can get from just stopping for a second. I set a timer on my computer that makes me get up every hour for 5 minutes. Right? Well, it doesn't make me do it, but it reminds me, and so I do it.
Yeah.
Right?
Yeah.
Just take a break. So I'll end with that, and I hope everyone has a great holiday season, and we'll see you in 2024.
Fantastic. And thank you for the feedback, Frank. We appreciate you as well. Well, thank you so much for joining today. And again, if you haven't already, please make sure that you press that on the right-hand side of your screen for the next event that we'll have in January. And we look forward to seeing you. Happy holidays if we don't see you prior.